everyone, and welcome to the Women's Legislative Network Monthly Boost. I'm Martha Sines, and I, along with my colleague Irene Kawanabe, provide staff support to the Women's Legislative Network. This monthly series is intended to help women in legislatures grow, learn, and connect on issues that are most important to you. Each month offers a different theme and topic aimed at fulfilling the mission of the WLN and responding to your needs. I'd like to thank each of you for joining us today. I'm pleased to introduce today's moderator, South Carolina Senator Katrina Shealy. Senator Shealy is the chair of the South Carolina Senate Family and Veterans Services Committee and serves as the Southern Regional Representative for the Women's Legislative Network Board. Senator Shealy, the floor is yours.
Hello, everyone. I'm happy to join you for today's topic, the many hats of caregiving, from childcare to aging parents. Women bear most of the burden of caregiving in this country. With the supply of childcare on the decline and the rise of our aging population, the demands are becoming more challenging. According to AARP, 2 out of 3 caregivers are women. During the next 45 minutes, we'll hear from NCSL's expert Jennifer Palmer on how states are looking at approaching to childcare challenges highlighted by COVID-19 pandemic. After, we'll hear from Lauren Ryan with AARP on recent studies and research on aging women and caregiving. Before we hear, before we hear from our experts, I want to review a few housekeeping items. Today's event is in a platform for development, information exchange, and engagement. While we're here, we've all become familiar with Zoom. Of course, we have over the pandemic, with a couple of reminders. We'll encourage the use of chat box. Please submit questions and answers throughout the meeting. Our experts will address all questions after they've facilitated discussion and presentations. Last, please take a minute to review your name. Click on the 3 dots in your box and insert your legislative title or organization and state so we can easily identify who has joined us today. Think of this way as your networking name badge. Today's webinar is being recorded and will be available on NCSL's website, along with themes for upcoming boost and registration links. We'll put that link in the chat box. Please feel free to share this site with your colleagues and staff. All right, let's get started. Please join me in welcoming Jennifer Palmer. As a senior policy specialist, Jennifer, or Jenny Palmer, works on a range of early childhood policies with a special focus on in-child care and early care and education workforce. Prior to joining NCSL, Palmer worked in political communications and in the Iowa House of Representatives. She earned a master's in public administration and is currently completing an early childhood leadership certificate, both from the University of Colorado and Denver. Thanks so much. We'll get to audience questions after our presentation. Please submit questions in the chat. Additional resources from Ms. Palmer will also be shared in the chat. Thanks, Jennifer.
Thank you so much, Senator. Pleasure to be with all of you today. As the Senator said, this is an issue that has been taking up a lot of my time the last few years, and there's been a lot of exciting developments in the state. So I'm really excited to share with you some of the things that we've been tracking here. This is certainly not going to cover everything. So if you've got examples from your states on the different topics that I touch on, please feel free to share them. So you've all seen the headlines. We all know what the issue is here. We know that the childcare challenges facing parents, particularly mothers, are just unprecedented. We're down about 11% in childcare supply nationwide from pre-pandemic levels. Those who do have care are still experiencing disruptions to their care due to staffing shortages and COVID exposures, and of course, rising costs. We know that nationwide costs are up about 5 to 7% for childcare, which, depending on where you live, what type of care you have, and the age of your child, can just eat up a really significant portion of household income. This is affecting even some of your colleagues in the Oregon legislature. We heard from a few legislators who are leaving their positions due to rising costs and inability to care for their young families while serving in their states. For childcare business owners, the challenges are real related to hiring in the current job market. And this is in large part due to the low pay in the field. We're going to get into these issues a little bit more, but I'm guessing that all of these things on your screen are not surprises to any of you who have an interest in this issue and have been paying attention for the last couple of years. So for those in the field, the childcare professionals serving in either home-based or center-based, again, the low income, the low wages in a very stressful, demanding job are forcing many to rethink their role in the field. And we know that their income puts them at about the second lowest percentile of income of all professions in the state. They work really demanding, stressful jobs, often don't have access to benefits, and a significant portion rely on public benefits then, either TANF or SNAP benefits or the like. So I want to talk about how we got here. You probably also know that the large majority, of the profession are women, and a disproportionate amount are women of color. They lack access to benefits. They face these difficult working conditions. Meanwhile, for business owners who want to raise wages and improve benefits, raising those wages would mean charging families more. And as we mentioned, it's really difficult to do when most of that cost is passed on to parents. For those providers that serve families using subsidies, it would require a higher reimbursement rate. And I'm going to talk a little bit about changes to those reimbursement rates, which is the money that providers who serve subsidy using families are then reimbursed for their care. And often does not reach what they can charge privately paying families. And so many opt to not serve subsidy using families for that reason. It also means that they can't offer competitive wages, and it means that they might not be able to invest in other quality improvement measures. So I'm going to talk a lot about some of the solutions to these challenges. A lot of it has to do with workforce and access issues, but I would be remiss to not mention I'm not a member of NCSL's labor team. I'm a member of the early childhood team. And so it's imperative that I show you some cute kids and tell you why this matters for young children, which I think many of you on the line probably already know that in the early years, especially those kids 0 to 5, the foundation that is laid during those years for all the growth and development that occurs later in life. It really depends on relationships with caregivers, whether that is caregivers in the home or caregivers outside of the home. The quality of that caregiving is really the linchpin of all of this healthy growth and development we want to see in those first few years. And with that high turnover, with the stress in the field, we know that that can impact the quality of caregiving that young children are receiving. So how have we typically seen states address access and quality in legislation? This is just a sort of example of what we typically track every year in our legislative database and most of it is geared at either raising quality through health and safety and other measures or offsetting costs. You can see on your screen here, here's a few ways we usually see states trying to address these high costs for families, for employers, and for childcare providers themselves. How has COVID changed the game? The answer is that we're seeing a lot more of these same types of bills. We've had about double the childcare bills in the last year than we usually track in a year. And I anticipate this year being even more so. So we've got more legislators and policymakers paying attention to these issues than ever before, which is in no small part, driven by the increase in federal funding. I just want to recap for those of you who this might be new to, or a refresher for those of you who are well steeped in this area, the amount of funding that was offered up in the American Rescue Plan specifically for childcare. Of course, some states opted to use some of their state fiscal recovery funds for childcare, but I'm going to talk mostly about these two buckets here, which went through the Child Care Development Fund, which is the largest federal funding stream that states match and tap into to support access to care for low-income families and improve quality. Now, the $24 billion you see there for the child care stabilization grants was sort of like a $24 billion Band-Aid. It was designed to sort of stop the bleeding, and it only went to providers who were already in business. States are still spending this money. They have until September of this year to obligate those funds, and I believe until the next year to actually get them out the door. So I'm going to focus most of my time on that $15 billion there in the supplemental discretionary funds. This is where states really had an opportunity, had more flexibility and opportunity to be innovative in how they expanded quality and how they expanded access. So this is just a summary here of the guidance from the feds in how to use this money. You can see it's pretty broad. I want to give you some examples of how states have then taken this guidance and actually put it into practice in their states. Let me come back to those reimbursement policies, which might not sound super innovative, but make a huge difference, especially for access to families with who are using those subsidies and have challenges in accessing quality care. So reimbursement rates, again, the money provided to providers who are serving families using subsidies, states have flexibility to set those themselves. Nearly all of them set it based on a market rate survey, which is actually sort of a survey of how much parents in the surrounding area pay, not how much it costs to provide that care. The federal government recommends that states set this reimbursement rate at 75% of the market survey. That's to ensure equal access to low-income families to the providers that privately paying families would be able to access. Now, in 2020, only one state met that benchmark, so most were well below it. With the increased federal funds that I just showed you on the last slide, we saw 20 states in DC raise those rates. But more importantly, or maybe not more importantly, but on a bigger scale, we saw more states change the policies about how they pay those, and that is changing it when a child is absent or missing care, that providers were still able to receive funds. We saw 33 states and DC make those changes to allow payment based on enrollment of children instead of attendance of children. Now that allows for more stable income for those providers, and during a time when many families were losing their jobs or keeping children home, and all of that. So these big changes, though, were all temporary. We're going to see how much of these actually stick. The National Women's Law Center does a really great job of tracking these changes. Their report on how these changes might be ongoing is out later this month. So stay tuned. Another change to reimbursement policies, as I mentioned, that market rate survey doesn't cover, it is more an assessment of how much parents pay. It's not how much it actually costs to provide that quality. So we've seen a few states, or one state and DC, switch to a cost of care methodology to determine how much they will then pay providers who are providing subsidy care. We know that making this big change requires a big study to understand what the actual cost of care is. It involves a lot of stakeholder engagement. And we're seeing Vermont as another state who is undergoing that process to identify switching from the market rate survey to the cost of care. And Tennessee has changed their language to allow for this change in methodology, but is not requiring it at this time. So New Mexico, though, and DC are leading the way in a few other ways. You might have seen these headlines earlier this spring that DC is raising compensation considerably for child care workers throughout the district. They'll be sending checks of $10,000 to $14,000 directly to child care workers, depending on their qualifications and their role within the center or home base where they work. This was driven by the Birth to Three Act in 2018 that provided a whole comprehensive list of services and programs for parents of young children, but it wasn't funded. So just last year, the district implemented this tax on high income earners to help to fund this raise in income for providers. Now, I also want to mention that Maine, they have just passed their budget to include $200 a month wage supplements for all child care workers in licensed settings throughout the state. they're using general funds, which is unique, and they have guaranteed to do this through 2023. And I think that this is unique in that, prior to COVID, we just really didn't see legislation directly impacting compensation for the childcare workforce, again, prior to the pandemic. Back to New Mexico, they've recently announced that they are raising eligibility for subsidies from 200% of the federal poverty level up to 400%. So as an example, that would mean a family of 4 earning $111,000 a year would qualify, and they would have no copays. Other states that have come close to this include New York, who has recently expanded to 300% of the federal poverty level. And Texas is offering free or nearly free care for those who work in certain industries for the next year. Industries like the arts and the hospitality, and I believe essential workers as well. A few other measures to build up the supply for underserved populations here. Kentucky, as you can see, is doing a lot. And when we say underserved populations, what we mean are, those who struggle to access licensed care. It usually includes low-income communities, families with infants and toddlers, families with children with disabilities, families whose first language is not English, families who work non-traditional hours, and so forth. These types of families typically turn to home-based or family childcare because it's able to meet those different needs. And so you can see Kentucky here is investing in increasing access to family care and hoping to bring on more family care providers with those startup grants, with the business partnerships, and other methods. We've seen this in other states too. So again, if this is happening in your state, please let us know in the conversation after or in the chat. Kentucky is also part of a trend around helping to bring on employers as part of the solution. I think as we've had more legislators, paying attention to childcare, they're sort of asking, where are employers in this situation? And there's at least 3 states who are embarking on these public-private partnerships, say that 3 times fast, where essentially it's a tri-share model, as Michigan is calling it, where the employer, the employee, and the state contribute 1/3 each of the cost of care. This is designed to serve, in all 3 states, this is really aimed at serving employees who are sort of lower to middle income employees. They make too much to qualify for subsidies, but still struggle to afford care. And so we know that Michigan, their pilot started last year with a $1 million grant. It has since received $2.5 million in the state's budget to expand. And Kentucky is using $15 million in general fund dollars, actually, to provide this service to, it's a first come, first serve basis. So employees that apply and employers who agree to be a part of it can benefit from these dollars. Let's take it on down. A few more efforts here. Again, this is not a complete list, but I just wanted to show you a few more examples of how states are thinking about quality, and especially when it relates to the workforce, when it relates to supporting the professionalization of the workforce and bringing on new professionals and getting them up and running. There's a small asterisk there by Rhode Island because their startup grants for family child care is funded with those state fiscal recovery funds, which is unique that they went outside that bucket of designated child care dollars and decided to invest their state's fiscal recovery funds in child care as well. Again, just a few examples here. I'd love to hear from you all about how your state has approached any of these, is using any of these, is considering them, has thought about it, would like to learn from other states that are doing these. All open for discussion. I'll leave it there with a couple of resources, and I'm happy to take any questions.
Thank you, Jennifer. We appreciate you, and we'll get to the audience questions after our next presentation. And again, I want to remind you that we'll take questions in the chat box, and resources from Ms. Palmer will also be shared in the chat box. And now, as we switch gears just a bit, we're going to prepare for our next presentation portion of the webinar. I'd like to remind everyone The mission of the Women's Legislative Network is to promote the participation, empowerment, and leadership of women legislators. The network does not advocate for or against specific state policies, but sponsors informational briefings so legislators can better understand an issue and learn from one another. Our next esteemed expert is Lauren Ryan, a senior legislative representative with AARP's Government Affairs, Family, and Caregiving team. Since joining AARP in December 2020, Lauren has served as an issue expert on a variety of topics, primarily focusing on family caregiving, telehealth, and food insecurity. In her current role, she advises AARP's 53 state offices on policies that can improve the lives of older adults and their families. Thanks, Lauren. Look forward to hearing from you.
Thanks. I'll just share my screen really quickly. See if we can. All right. Okay, so hi everyone. As Senator Shealy mentioned, my name is Lauren Ryan, and I serve on AARP's Government Affairs, Family, and Caregiving team. I'm so happy to be here with you all today to talk with you about caregiving and what states can do to support family caregivers. So before we get started, I just want to share a quick snapshot of my planned agenda. I know we only have a short time, so I'll do my best to give you all a good foundation, share an overview of some of the things AARP is focused on, and then also share a few resources with you in case you need to turn to them for more information. So let's just jump right in. As you probably know, one of AARP's top priorities is finding ways to better support America's family caregivers who help their older parents, spouses, and other loved ones with things like everyday tasks or even performing more complex nursing treatments. And they do this so that their older family members and loved ones can live more independently at home. And just to provide a few statistics here on who family caregivers are, about 21% of Americans, or 53 million people, have served as a family caregiver to an adult or child with special needs in the past year. And 19% of people have provided unpaid care to at least one adult. More than 60% of family caregivers are women, and more than 60% work in addition to providing care for their loved ones. And I think this last point about women caregivers is an important statistic to remember as we get into some of the next few slides. I know this was mentioned before, but you know, women can experience, women are often charged with those responsibilities more often than men, which means they can experience the negative impacts of caregiving at higher rates. And while all caregivers, regardless of gender, often face significant challenges, again, women sometimes face those at higher rates. And one example that we've seen is since the coronavirus outbreak, women have left the workforce at rates 4 times that of men. So just a brief example of why that was an important stat. As I'm sure many of you know firsthand, caregivers are a crucial part of our long-term care system. They serve an invaluable role, often ensuring older adults are able to age in place and remain in their homes and communities where they prefer to be. But family caregivers also benefit the broader economy. Family caregivers provide about $470 billion in unpaid care each year, which provides an important benefit and savings to state economies. And you know, on the flip side of that, family caregiving often has a significant financial impact on caregivers themselves. On average, caregivers spend more than $7,200 a year on caregiving expenses, which on average equates to about a quarter of a caregiver's income on caregiving activities. And as you can see in this infographic, the financial burden is also often higher for people of color. And just as it's important to acknowledge that challenges can vary and certain communities and groups often face distinct disparities, I think it's important to acknowledge that all caregivers as a whole face a variety of physical, emotional, and financial challenges. While I already mentioned some of the direct financial impacts on caregivers, I also wanted to note that financial challenges are pretty widespread amongst family caregivers. It's not a select few. 45% of family caregivers say they've experienced at least one financial impact due to caregiving, and those are things like facing career challenges, inability to save, inability to pay bills, or taking on additional debt to help fund those activities. 26% have difficulty coordinating care for their loved one, and 23% of family caregivers say that caregiving has made their own health worse. And while these statistics are concerning on their own, it should be noted that demand for family caregiving, as I think was mentioned a little bit earlier, and the reliance on them to carry out increasingly complex medical tasks is really only growing. So without the interventions to support family caregivers, these challenges that they face will only grow in turn. So one of the things we're often asked is, what can we do to solve this crisis? And, what are AARP's goals when it comes to solving these challenges? So I think there are three main areas we look at when we're looking at policies to support family caregivers. The first is to support caregivers themselves through things like training or alleviating some of the financial, emotional, and physical challenges that they face. By supporting family caregivers through these types of policies, we're also working to improve the quality of care that's offered to older adults that are remaining in their home. And then that in turn helps to increase older adults' ability to live at home or in their communities. And that allows them to age in place. I know I've mentioned this a couple of times already, but I think it's important to mention again here that home is where most older adults prefer to be. In fact, 77% of adults 50 and older want to remain in their homes for the long term, and that's a number that's been consistent for decades. So before we turn to how states can work towards these goals, I wanted to give a quick snapshot of some of the more recent federal actions. And in the interest of time, I'll just sort of give a quick overview of two of them that I think relate really well to what some states are also doing. The first is the Raise Family Caregivers Act. Raise essentially established a caregiver advisory council that's tasked with identifying and suggesting some of the best ways to support our family caregivers nationally. Their first report was released, I believe, last fall, and their upcoming national strategy will put forth recommendations based on that initial report and is expected to be released later this year. I should note that quite a few states have also established their own advisory councils or similar working groups to address the needs of family caregivers at the state level. And then the second policy I want to highlight is a federal tax credit to alleviate some of the financial challenges family caregivers face across the country. This hasn't passed yet, but the bill does continue to gain more and more support, and we're hoping to see it gain even more momentum going forward. So I want to focus now on some of the policy trends that we have seen states try to address some of the needs of family caregivers. The first suite of policies are paid family, medical, and sick leave. And I don't want to spend too much time on this, and I know it overlaps quite a bit when you're talking about childcare. But again, I think it's important to note that this has gained growing momentum in recent years. And I just want to add a few quick points here between paid sick leave and paid medical leave, both of which are important. I think many of us associate paid family medical leave most directly with parents and children or new mothers, which is obviously one major component. But with the growing number of family caregivers that I mentioned a bit earlier, I do think it's important to remember that many people, and often people who are in that sandwich generation, but who are caring for both their children and their aging parents or other older family members, are impacted here. And I think that they could also benefit from these policies whenever caring for aging family members. We also like to note that all workers, including family caregivers, should be able to take the time they need to care for both themselves and their loved ones. And caring for a loved one shouldn't mean losing your pay or your job. The second policy that where we've seen quite a bit of action actually, and I think this has gone a long way to help support family caregivers as they're taking on some more of those more complex medical tasks, is the CARE Act. The CARE Act addresses some fundamental expectations to support better communication between both healthcare professionals and family caregivers as the caregivers prepare for those complex tasks at home. The name of the law and its specific provisions often vary from state to state, but the legislation generally requires that hospitals do three things. The first is to advise individual patients of their opportunity to identify a family caregiver. The second is to record that caregiver's name and contact information in the health records so that they can be contacted. And then it's also to enable family caregivers by contacting them and providing as much notice as possible about discharge discharge timing, I'm sorry. And also consulting with them about the discharge plan, discussing their role in carrying out that plan, and then again, instructing them about some of the medical nursing tasks that will be needed at home. By doing this, our hope is that caregivers are better trained and supported as they fulfill their caregiving duties. And again, I think this in turn reduces some of that unnecessary anxiety or emotional and mental strain, and also provides that overall better care for the older adults who are being cared for, and ultimately results in reducing harm and a decrease of readmissions. And then finally, I want to highlight a few additional areas of focus that we've seen and that has gained some momentum and interest at the state level. The first, many states are looking at ways to alleviate some of the financial challenges that caregivers face. Mirroring efforts at the federal level, more than a dozen states this session have considered family caregiver tax credit and reimbursement programs. Some are looking at, traditional tax credits, again, modeled after what we're looking at the federal level, and others are exploring things like pilot and grant programs that might be a little closer to a reimbursement but again, all of those things are the goal. The express goal is to help alleviate some of those challenges that are associated with caregiving. Maine, for instance, last year passed legislation to establish a reimbursement fund. The second policy I wanted to mention, which is somewhat connected to the tax credits and reimbursements, states are also exploring ways to enhance respite care programs. As I mentioned before, family caregivers face quite a variety of challenges that's not always financial. And oftentimes one of the best, most beneficial, one of the most beneficial things we can do for caregivers is to provide an opportunity for them to just take a break and be able to take care of their own needs. Respite care might include things like bringing in someone to provide in-home care, or helping fund an adult day center, allowing family caregivers the chance to step away from their caregiving responsibilities while also ensuring that their loved ones have the care that they need. And I think that's important too. Family caregivers want to make sure that they're not just leaving, that the person they're caring for has access to the care that they need to be healthy and happy. And so respite care can sort of fill that gap and allow them to be able to step away. And then third, many family caregivers also serve as legal guardians. And we've seen almost 25 states form something known as WINGS. It's Working Interdisciplinary Network of Guardianship Stakeholders. And those networks drive change in adult guardianship policies with the view that improving these practices can help promote less restrictive options and also address potential abuse. Two areas that I don't have on this slide, but did want to quickly mention that could offer some additional support for family caregivers are things like telehealth and caregiver assessments. Telehealth, I could talk about all day and give it its own presentation on that. That's a huge piece. But one of the things that I think is important and isn't often the highlight when we talk about telehealth is how it really can support family caregivers, especially those who are long distance caregivers and working caregivers who can't often take a significant amount of time off work to help take their loved one to a doctor, but really need to. And so ensuring caregivers are also factored into that equation and are part of that conversation can help reduce some of the stress associated with the time, travel, and financial barriers that a caregiver might face if they're helping a loved one access care. And then separately is caregiver assessments. If you include a caregiver assessment in an existing program or another program where you're already having a touch point, that can help address some potential issues before they happen, or can better connect caregivers with existing services that may be of benefit. And again, can sort of address some of the issues and challenges that they're already facing. So that's another way that programs that are already in existence, or if there are already programs and policies in place, you can help make sure that people have access to them. So I know that was a lot of information and I probably went super fast because I know we're short on time here, but I did want to just share with you a few resources and end my portion of today's presentation by sharing a little bit of what AARP has. The good news is that there are a lot of really great resources that has tons of information from a variety of different organizations that can help caregivers navigate their roles or help people who are interested in the issue learn more about either the issues with caregiving, the challenges caregivers face, or some of the policy recommendations that are floating around. But again, in the interest of time, I'll share just a few particularly great AARP resources. First, I want to highlight a few of our digital resources and guides, including our Caregiving Resource Center, which has just a wealth of really great information and tips for family caregivers. We also have a number of resources available in multiple languages. We have something called a Prepare to Care Guide, which offers helpful information for new caregivers, and that's available in English, Spanish, and Chinese. In addition to resources for new caregivers, we also have guides for different types of caregiving situations. And those can be things like things meant for military families or LGBTQ families. And you can also, we also have a dedicated toll-free resource line. And while the agents can't provide specific advice to callers who are seeking information about caregiving, they can suggest resources or connect them to resources for a variety of issues, including things like long-term care, legal issues, financial issues, or home care. And that support line is also available in Spanish. And then finally, I just wanted to note that I am always happy to be a resource to anyone with questions, but I'd also encourage you to connect with our All-Stars at your local AARP state office. They have tons of information. They're all working so hard to make sure that we're supporting older adults and their families. And so would encourage you to connect with them as well. And then, just to sort of echo what Jenny had mentioned during her presentation, would love to hear suggestions or examples of what you all have been working on in your state, or if there are, again, other resources we can share or examples we can share from our work. Happy to do that as well.
Thank you, Lauren. And I got to tell you, I was so interested in your information that I almost got lost in it, because I am actually the caregiver of a spouse with Alzheimer's. So I can relate to everything you said. We are almost running out of time. So I don't see any questions in the chat box. So if anybody has any questions, now would be the time, I think, to speak up and let us know if you have any questions. So if not, you can still contact us and submit questions, but we would like to extend a thank you for our presenters. And most of all, I hope everyone has found today's webinar informative and valuable. I do see questions now. Let's see. Someone asked if the presentations will be sent to us, and I'm sure they will. I think someone from NCSL can answer that, but yes, they will be sent to everyone, and we can make sure that everyone on the webinar today will have the information sent to them. Both presentations will be sent. So we want to thank all of our attendees for participating in today's webinar, and we'll make sure you get all the information. As a reminder, a recording of today's webinar will be available on NCSL's website, but don't forget to register for next month's monthly boost, which will focus on women and the energy sector. The monthly boost is taking a break in June. The next boost will take place on Friday, July 8th at 2 p.m. Eastern time. So I hope everybody, I know this was great. This was a great informative webinar today. I learned a lot, and I know the rest of you did. So I want to thank everybody for attending. And let's see, I think there might be, if there are no more questions, I'll turn it back over to those at NCSL if they have anything to add to this, but I appreciate everyone being here. It was great.
Thank you, Senator. Thank you so much for moderating. Thank you again to our esteemed experts on these topics. It was very informative. I do also want to encourage everyone, there will be a Women's Legislative Network track at NCSL's Legislative Summit in Denver, Colorado, August 1st through the 3rd. And there will be a session during that time that includes policy roundtables, and we'll be revisiting this topic in particular with caregiving during those policy roundtables. So that'll be an option in there. So if you are interested in joining that conversation, please join us for that session.